Buenos días con todos y todas. Good morning to all. I'm just giving a few moments so people can join. And see Argentina, Canada, Chile, Cuba, Antigua and Barbuda. Very nice. Lima, Peru, Bogotá, Colombia, Paraguay. Very nice. Mexico, Philippines. Welcome. South Africa, Colombia, Ethiopia, Venezuela, Haiti, Morocco, Uruguay, Germany, brilliant. Trinidad and Tobago, Dominica, Belize, amazing. This is way over a Pan American climate and health course. St. Vincent and the Grenadines, Nigeria, Trinidad and Tobago. Bonjour, Haiti, Canada, Peru, Brazil, Grenada. Yeah, good morning to all. Bahamas, Scotland, amazing. Colombia, Peru. Buenos días con todos. Solo damos.
Good morning, everyone. So 30 more seconds so that everyone can join the meeting.
United States. Very nice. Turks and Caicos. United Arab States. Excellent. Okay, I think we're gonna start, and we can start slowly with the housekeeping, and then we can move to the presentations. But thank you so much for being here today. It's a pleasure to and an honor to be hosting and moderating this session. My name is Daniel Booth. I'm the Unit Chief on Climate Change and Health for the Pan American Health Organization, PAHO. I'm based in Washington, D.C., and we manage from there the agenda for the Americas on climate change, water sanitation and hygiene, waste management, chemical safety, air quality, and environmental health surveillance. So it's a pleasure to be here with you today. So I think that we do have, although I don't see the button of interpretation on my own screen. I guess we do have it. You can find interpretation you should find it in your Zoom session. So live interpretation is available in English, Spanish, and French. So please go ahead and use this button. We'll be switching in this session from English to Spanish. So please find the time to find this button if you need interpretation to navigate through the languages. Hay una interpretación en vivo. Ustedes tienen este botón que
There is live interpretation. There is this button where you can choose your language, and you can choose English, French, or Spanish as languages you can listen to.
So this course is as you know, a 9-session course every Tuesday and Thursday. We do have this specific session today, Thursday, April 13, on health adaptation process, key actors, activities, and partnerships. I hope you enjoy it as part of this online training course. And please use the chat and the Q&A to ask questions as we move. So these are some housekeeping for the ones taking the whole course. The general considerations, attendance will be verified when you are connected. So please you don't have to do anything else apart from joining the session and hopefully staying the whole 90 minutes. The session, the run of show of today is that I'll be doing a presentation in the beginning, and then I'm going to have a panel. We have three excellent panelists to discuss with you today. And at the end, if we still have time at the end of the session, we want to have, or we're trying to keep a moment to have some interaction with participants. So please enter your questions in the Q&A, and we can ask panelists to discuss the questions. These sessions will be recorded and posted on the website within 24 hours. I think you know that already. And slide decks for the main presentations are available for download on the course website. So today, like I said, we have the pleasure to have this session with Dr. Carmen Siganda, Dr. Carmen Siganda from the Ministry of Public Health of Uruguay. I will introduce their bios when we are done with the initial presentation and we are about to start the panel. But we also have the pleasure to having Craig Brown, Dr. Craig Brown from Vancouver Coastal Health, and Anivar Peralta from the 5Cs. He's a project development specialist. So with no further ado, I'll switch to my presentations and then we can move ahead with our session today. So thank you so much. We have at this point over 400 participants. So I'll switch now to Spanish. So please find the translation button if you need it. And the panel will host it both in, we'll have it in Spanish and English. So please find the time to find the translation button and we'll switch to Spanish now. Thank you. Bueno, hoy la idea es hablar un poco del proceso de adaptación.
Today, I'll be talking about the adaptation process regarding health systems. We have key actors, activities, and partnerships. We need to think about how we can build an agenda to strengthen health and climate activities. At PAHO, and in agreement with 35 countries in the Americas and 18 territories in the Americas, we developed an agenda to strengthen these climate and health actions. The agenda includes 7 main working pillars. The main aim is to create climate resilient health systems and to reduce mortality and morbidity related to climate events. I'm sorry, Daniel's audio is quite poor, so we'll do our best to summarize what he's saying. This is a main aim of PAHO's agenda. Regarding institutional structure and governance, I would like to address these pillars, and then I will provide some examples and say which are the necessary structures and partnerships in our experience after working with the countries I've mentioned. Regarding governance and institutional structures, they are the main driver of working with health in the systems that coordinate climate change related actions. And this is the case nationally and regionally and globally. The health system should include communication networks with other sectors. And this should be the case in the Ministry of Health. So we need to be able to agree among the different stakeholders so that we can have a common health position in order to participate in interministerial committees on climate change. Health should create knowledge and also take this position to other strategic stakeholders and other sectors, the private sector as well. And we should, they should talk about the strategies and tools to strengthen health systems and to make health systems climate resilient and to reduce mortality and morbidity related to climate events. The second step in this structure has to do with health and education planning. Once health is strong and participates in institutional structures, then it is time for planning. There are several documents that countries, provinces can develop. And also several countries can create these documents to create work plans, specific health and climate change action plans. Therefore, the NDCs for the UNFCCC, vulnerability studies on health, planning, national adaptation plans that include health issues. All of them are essential documents to be able to understand the impact of climate change on health and also which challenges the health sector and other sectors have when it comes to turning health systems into climate resilient systems and to reduce morbidity and mortality in this regard. The second pillar is to get the necessary funding for climate and health projects. When we have the planning and the funds, what can we do? What can we suggest? There are four main pillars in this regard. And the countries have recognized this, but not just countries, also mayors, for instance. In some countries, we're working at province levels. In Argentina, in Neuquén, Patagonia, they are working in this regard. And I will share some specific examples. The idea is to strengthen health infrastructure and to build climate resilient systems. Therefore, infrastructure needs to be safe so that different types of hurricanes or droughts can be faced. Also heat waves, because all these events might increase the number of patients the health system needs to care for. Therefore, we need to build integrated systems for health and climate surveillance so that we can, first of all, prevent diseases so that we can understand the impact of climate change on health, also prevent conditions related to climate change through integrated surveillance systems that are integrated with other meteorological services. They should be able to develop response plans and to prepare systems to face these problems and to reduce the impact and to recover more efficiently from them. And I think that health research and education includes health practitioners, but also the general population. These actions focus on the health sector and on what the health sector does. There is also a fourth pillar that has to do with health co-benefits outside the health system, for instance, food systems, green areas, etc. They have a direct impact on health. And this is why health also needs to develop plans and policies with other sectors. I would like to tell you about some strategic stakeholders when it came to implementing this strategic and ambitious plan. Before that, I would like to call your attention to the following. Climate change is here. We can see it, we can feel it every day. There are heat waves. Today, I'm in New York, for instance, and today we have a record high temperature in the city of New York. Therefore, the impact can be of climate change can be felt. However, climate change affects vulnerable populations the most, and that we know, of course. But we need to remember that we have an incomplete basic infrastructure agenda, for instance. The people that are most affected by climate change are the ones that create less climate change. In fact, also the ones that emit fewer greenhouse gases, but they're the most affected ones. In the Americas, we still have people with open air defecation. We have 160 million people who have no access to safe water sources. Regarding air pollution, over 320,000 people die every year in Latin America and the Caribbean because of cardiac and respiratory diseases and cancer that have to do with air pollution. Over 74 million people depend on polluting fuels, wood, coal, and kerosene for cooking and heating. Therefore, remember the Millennium Goals. We haven't quite achieved them. Therefore, we now have problems that are worsened by climate change. And the people affected have less access to health services, and they're more vulnerable to air pollution, chemicals, etc. And they are the most affected ones. There's over 1,000 premature deaths a year. They could be avoided. They have to do with the environmental risks. And we already have the necessary knowledge to be able to close that gap, but we are not succeeding.
And this has to do with equity. The percentage of deaths related to environmental risks in high-income countries is 13%, while in low and middle-income countries, this number is almost 19%. So there's an obvious difference in access and also in the contamination, the pollution in low-income and high-income countries, and also the low-income population within high-income countries. So we have differences within a city, within a country, and within a region in the Americas. So it's really important to work on this inequities in impacts if we want to provide the best health possible for the entire population of the Americas. So for this, in PAHO, we have an agenda that is the agenda for the Americas on health and climate change. You have it, you have the cover there, and it's related to the Sustainable Development Goals and the strategic plan of PAHO. And these are things that are at the core of what I'm going to discuss now. And also the WHO, I suggest you learn about this manifesto for a healthy recovery from COVID-19 that has to do with protecting and preserving the source of human nature, of human health, that is nature, so green areas. And we're working within the WHO, working on the link between health and environment, to invest in essential services, water and sanitation, to ensure a quick and healthy energy transition, to promote healthy, sustainable food systems, build healthy, livable cities, and also to stop using taxpayers' money to fund pollution. As a health sector, we have a regulatory responsibility as well. So we need to ensure that countries have very clear guidelines and criteria to stop subsidizing the use of polluting fuels at home, in transportation, and to generate electrical power in general. This is really important and key to have a healthy, sustainable world. At the COP26, so 2 years ago, we worked on a healthy climate prescription letter. I always like to go back to this story because organizations representing over 46 million health professionals from 100 countries started working on a special health prescription, we call it, and that is very representative. But it has an impact on policy and on the progress of a global health and climate agenda for all countries. Today, we have 69 countries that have entered into this initiative. The acronym is ATTACH. It's an alliance for transformative action on climate and health. And it includes already countries from different regions, and the countries have made commitments on adaptation and also mitigation actions to mitigate the effects of greenhouse gases in the health sector. And now going into those pillars that I mentioned at first, we have within the governance strategy, we already mentioned some key partners. And those regional alliances also include multi-country agreements. Perhaps Dr. Siganda will discuss the Mercosur and associated countries' ministries of health declaration on health and climate change. Dr. Siganda, I'm sure, will go into depth on this. And now we are in the process of having a new agreement for South American countries and ministries. We also have one for the Caribbean Action Plan on Health and Climate Change. This was signed not only by health ministries, but also by environment ministries. So these are strategic partners at all levels, of government. It can also not just be multi-country agreements, but also within a country, agreements between provinces, like in Argentina, that have those shared plans, and also locally, not just municipally, but also locally. So we can have these plans that clearly link health and the environment and have measurable, clear plans. And that is what those plans have. We have the Caribbean Action Plan, the Climate Change Plan of the Andes, and we're now working on one for the Central American Climate Change Action Plan Health Agenda. So this multi-country at the national level agreements Of course, we can also use those tools within countries as well, as I was mentioned. And with Health Canada, we developed this guide for implementing vulnerability and assessments and national adaptation plans. We have a guide for that, for health national adaptation plans, and also how to prepare NDCs that are the nationally determined contributions under the agreement, the UN agreement. So these are all tools that are available for you, and I suggest you get to know them. We are also work on surveys and country profiles in which we look at the projections, the climate projections for each of those countries and how that reflects on potential and estimated health indicators and what actions should country take. That is the first step for a national action or adaptation plan at the national or subnational level. And now I'm going to show an example of how to do that on a provincial level or a state level within a country. I borrowed this from our colleagues into how they created a committee, a sort of task force, because we discussed governance and the preparation of an action plan at the province level. So this is the planning part where they identified the gaps and they developed the guidelines for what do we want to do so to make the Neuquén's health system more climate resistant, more climate resilient, and reduce the impacts caused by climate change. They mapped the strategic partners to work on environmental health and climate change within the province of Neuquén, also connecting and including the national level institutions. But the province takes the leadership role within the provincial action. And they generated a health and climate change province plan for Neuquén. I can't go into detail, but hopefully we have some of the colleagues from Neuquén here online, and so that we can connect participants to them so that they can share this very fruitful work that they have done. They worked so hard on this, and they also use funds from the Green Climate Fund for this. So I unfortunately can't go into detail, but perhaps you can connect with them if you want to learn more. So we need a strategy to generate risk maps. They're letting me know I only have 5 minutes. So we need to combine information from the surveillance system connected within a single platform with climate and meteorological information, environmental and demographic information to generate risk maps to identify the population that is potentially being more affected according to the different possible climate scenarios, to generate early alert systems. And we can have those for 10 years, perhaps, for some illnesses and diseases such as dengue that is not right now in some countries, but because of the distribution of the Aedes aegypti mosquito is growing, then, for example, now in the US, the Lyme disease that is transmitted by ticks is now spreading to Canada because the tick is spreading. So we can project the change in behavior, in ecological behavior of those species, and also foresee the change in the prevalence of those illnesses. I had a very specific example about dengue. I'm not going to go into detail, but for example, in Argentina, they have these early systems for heat. Colombia has these new newsletters on climate and health that are issued monthly, and they tell you what you can expect on your specific region of the country for the future according to the projections made. Cuba also does this. Some other countries have also made progress on this. And now going to the final part, that is policies and intersectoral actions. We have actions that look to prevent diseases and to promote health. We worked on a study in Colombia that if they implement their NDC, this can bring financial benefits of up to almost $13 billion for 2030. And they can save more than 1.8 billion US dollars a year. So using perhaps this lens of the avoided costs for the cost of inaction, because if we do nothing and we keep this trend using fossil fuels, what are the impacts that we can expect? So we need to use the argument of health to protect the lives of people and do this transformation or overhaul of the social systems to reduce the emissions from fossil fuels. We have resilient healthcare facilities. On Tuesday, you had a session that was for that, but it's one of the very key pillars of our agenda. And in terms of education and training, we have this book, and I would really like it if you could take a look at it, because it's made especially for healthcare professionals in general, but also for anyone who has an interest in learning about the illnesses that an extreme climate or weather event can bring, such as a heat wave or a hurricane, for health in particular, and especially for medical professionals, what drugs you should not prescribe, for example, during a heat wave, because they can exacerbate the effects of a heat wave. So these are materials that are very important that are available from us. Aside from the courses, of course, this is one of the courses that PAHO is working with the IAI and Columbia University. You, of course, know about that. We also have a course on water security, water safety, and we're working on preparing portfolios and local capacities for the Green Climate Fund, for the Belmont Forum, and other cooperation agencies. It's key to train the healthcare sector to be able so that they can prepare investment proposals to transform the healthcare system. Our colleague Anivar is going to talk about this climate change center and the work they're doing in the Caribbean in cooperation with PAHO and other partners. So thank you so much for your attention. I don't want to take up more time. So now I'm going to introduce the other colleagues in the panel. Perhaps you can turn your cameras on, Craig and Anivar. I can see you, Anivar. Oh, there you go. Great.
to English, back to English, and then we can have a balance because Carmen is going to speak in Spanish, Craig and Anivar are going to speak in English. So please choose your language of preference in the translations button. I'll present first Carmen Siganda, who is the Director of the Environmental and Occupational Health Division of the Ministry of Public Health of Uruguay. She's a medical toxicologist with diploma in public health. She's a professor at School of Medicine and the focal point of the National System of Response to Climate Change of Uruguay and of the Intergovernmental Commission of on Environmental and Occupational Health of Mercosur. We're going to have soon after her initial words, I'm going to invite Dr. Craig Brown, who is the Senior Scientist, Climate Change and Health at Vancouver Coastal Health Authority, where he supports climate change adaptation projects in the health sector with a strong emphasis on community collaboration. Craig is also an associate faculty member at Royal Roads University in the School of Environmental Sustainability and has served as an author on national and international climate change knowledge assessments, including the IPCC 6th assessment report. And we have the pleasure of having Mr. Anivar Peralta, who is the project development specialist for the Caribbean Community Climate Change Center, which is based in Belmopan City, Belize. He holds a master's degree in climate change from the University of South Pacific, Fiji. So a lot of experience in small island developing states. With over, I see that someone is saying that they can hear that they lost the audio. I don't know if everyone can do the same. With over 12 years of working in the climate change field, he utilizes his vast experience, knowledge, and resources to contribute to the 5Cs mission. And as a project development specialist, he's currently providing the technical expertise to mobilize sustainable and impactful climate change financing to build climate resilience and low emission development to Caribbean countries in partnership with PAHO, European Union, and other partners. So I'll pass the mic to Carmen Siganda. Paso el micrófono a Carmen para que pueda hacer. La idea es hacer intervenciones de 5 minutos cada, donde puedan comentar un poco de su experiencia y luego tenemos 2 rondas de preguntas.
And the idea is, Carmen, to have a 5-minute explanation of your experience, and then I give the floor to.
And then we're going to have 2 rounds of questions and maybe a final round of questions at the end with questions coming from the audience. So thank you, Carmen. Gracias, Carmen. Y tienes el micrófono.
Thank you, Carmen. You have the floor. Thank you, Daniel. Thank you, everyone. Thank you for this invitation to participate and to share with you the experience in this Southern Cone Market Mercosur region. Here I have a brief presentation to show you how we've been working. The full states that now address climate change and health issues in the Intergovernmental Commission of the Environmental Health and Workers in Mercosur are Argentina, Brazil, Paraguay, and Uruguay. This commission has 6 strategic pillars. So these are usually people that work at the Ministry of Health. And we actually coordinate these aspects. Our mandate is implemented through meetings of the Ministries of Health, also intergovernmental advisory committees. Our mandate includes 6 pillars: workers' health, waste, water and sanitation, chemicals, environmental health in children, and climate change and health, which was included in 2009. We work with ministerial resolutions, and we've been doing so since 2005. As you can see, these topics are interrelated because there is this transversality. Climate change is caused by GHG gases. Therefore, chemicals are included in this process from the beginning. This climate change affects the health of children and workers. It has to do with the necessary management of water and sanitation and waste management as well. We've been working on several documents since 2009. We started working with Paraguay while they were presiding over the committee. We started working on a first action strategy to protect human health. And this was our work found its inspiration on PAHO's work. This strategy was signed at the end of the year in Montevideo. In 2011, we organized a Climate and Health Training Institute. It was the first intersectoral work we did with the IAI, the Inter-American Institute for Global Change Research. The IAI is now based in Uruguay. Of course, we also worked with PAHO, with EDI, which is a Columbia University Global Change Institute, which later became a consortium at the University of Columbia. And also, and all of this allowed us to train employees from ministries of health and also health practitioners and people from the health, from the climate area, not just from the Mercosur, but also other Spanish-speaking countries from Latin America. In 2015, we confirmed the declaration of Mercosur health ministers while Brazil was presiding over the community. Countries preside over the Mercosur for 6 months, and we have Argentina, Brazil, Paraguay, Uruguay, and provisional presidents complete their mandate every 6 months. In 2018, Bajo organized a workshop in Argentina. We shared how we were working regarding NAPs. There was not just climate change plans that every country has and that are part of the Framework Convention. We also aimed to have a specific health and climate change plan. Towards the end of 2018, we issued a new declaration of Mercosur health ministers in Montevideo. So we needed to reinforce the importance of working on climate change and health. This time we worked on adaptation, but also mitigation. 2023, we have a new challenge. We have the provisional, Argentina is a provisional president of the Mercosur, and our challenge is to update the Mercosur action strategy. These are the topics of the 2009 strategy: producing scientific evidence about climate change and its impact on health, raising people's awareness, not just the population, but also students, health workers. Number 3, to forge partnerships among the different countries. We need to work jointly with ministries of health, transport, industry, foreign affairs. These are the ones that have participated in climate change framework conventions. It's very important for the health sector to participate with its delegates in the work commissions. Number 4 is developing both human and financial resources. As Daniel has said, to do things, we need a plan and we need a source of funding. In our first 2009 strategy, we focused on adapting the health sector. And we've always been told, well, the health sector needs to adapt. If there's a cold wave, how does this affect the population? How does a heat wave affect the population? How can we prepare our health services to adapt to these extreme climate events, hurricanes, floodings, etc.? But then we, as Daniel has just said, we noticed that if the health system were a country, we would be the 5th country regarding CO2 emissions. There are huge hospitals, so we do emit these gases, but also the pharmaceutical industry that works for the health sector are large contaminators as well. And when users go to the health centers, also use transport, energy, etc. Therefore, we need to also focus on adapting, but also on mitigation.
De la comisión que trabaja a nivel
Finally, these are the challenges of the Mercosur Committee. We need to strengthen the health, environment, climate nexus. We must keep participating in every regional, local, national event. We need to submit our NDCs in the area of health. These are the commitments that every country should submit. We need health commitments. It's not just about mitigating GHG gases and improving green areas. These are health co-benefits, yes, of course. But also we need to have specific public health NDCs.
Desafíos y retos es
A
contar.
further challenge is having national health plans, not just regarding adaptation and mitigation aspects. And finally, and something that is very important, you know, this health system course we're conducting now is we need to work with these stakeholders to have greener hospitals. We have been able to see what this whole climate change and health thing is about, because health providers will be interested in being more efficient, in saving energy, in managing hospital waste effectively as well. They will focus on managing water efficiently. They will want to have also green procurement. Who are we buying from? What are we buying? Also health-related inputs. And this was clear during the COVID pandemic. We need to make the most of this experience. How do we organize our work? Which vulnerabilities did we notice? How can we improve on them? And how can we have a climate perspective, let's say? This is what health, environment, and climate change is about. How we can work with from a One Health perspective. It's human, environmental, and global health. And we should take this as an opportunity to change. So these, here you can find the information regarding the resources used by our health ministers. Thank you so much.
Very important points that you raised. So I'll pass straight to Craig so he can make his open statements, tell us a little bit about his experience and how he sees that the community engagement at the more local level can support these plans that we are talking here. Thank you, Craig.
Thank you, Daniel, and thanks formally for the opportunity to speak, and to my wonderful colleague, Dr. Peter Barry, for forwarding the invitation to me from Health Canada. So I'm very happy to be here. I'm speaking to you from Vancouver, Canada, which is on the west coast of Canada, a very large country. I'm in a province called British Columbia, and I'm I work for one of 5 regional health authorities. So we provide health services for over 1 million people. We operate 13 hospitals and hundreds of other care sites. I'm speaking today from public health. That's the job I do. But I did want to say that although I'm focusing on adaptation and resilience activities, Vancouver Coastal Health also does much of the work that Carmen just mentioned around waste reduction and greenhouse gas reductions in our facilities and all of that. So there's more information that I could share about those activities for those that are interested. I'm part of a fairly small but growing team of public health staff that works, as Daniel mentioned, to support and protect health in our communities as the climate changes. That means contributing to, healthy, livable cities, strong ecosystems, and a big part of what we do is contributing to communities, local governments, their readiness or their preparedness for extreme weather events. And if I was to categorize our activities in the last few years, let's say the last 5 years, there's kind of 3 phases really. And I liked Carmen's slide that showed the timeline. So this is my attempt at a timeline, and they're really important kind of windows of opportunity. So basically, before 2019, our activities related to climate change and health adaptation in public health were largely driven by internal champions, we call them, or people who took it upon themselves to lead in this area. We didn't have a very formal approach or a strategic approach to our activities. In British Columbia, we have the British Columbia Centers for Disease Control, and they really were an anchor institution for us in the early days in British Columbia for climate change and health adaptation. That changed when Health Canada funded 10 organizations across Canada to undertake climate change and health adaptation projects. And Vancouver Coastal Health and our colleagues at Fraser Health, one of the other 5 regional health authorities in British Columbia, we were awarded 3 years of funding from Health Canada, and that represented a big change. It meant that we were able to work together with our colleagues in health emergency management and in facilities and in public health. And this is when I think things really started to gain a lot of momentum. So now, instead of it really just being the BC Center for Disease Control and a few really engaged staff members, we now had the opportunity to build a bit of a team. And then the next major thing that happened that allowed us to continue to grow in this space was in 2021, we experienced an unprecedented heat event here in British Columbia and in the Pacific Northwest of the United States. We're typically a temperate climate. We're a coastal community. We don't get really winter. We don't get hot summers. And we experienced extremely high temperatures during the day and overnight. Many of you know that hundreds of people died, and that has spurred a tremendous amount of action here. So it's a very sad event and tragic event, but it represented a very important turning point for our field in British Columbia. And luckily, the province of British Columbia also rose to this challenge, and through a provincial climate change adaptation strategy, alongside with our Ministry of Health, a whole other group of really amazing people have come online to contribute to this space. So I'll just end my short section here by saying that's a bit of a brief history, and it shows that this field just grows over time, and we're now in a place where we're really We've got a lot of great people working on this issue. And now, of course, the challenge, which I'll probably speak to later, is how do we stay coordinated and make sure that we're all heading in the right direction and doing great work. So that's my introductory remarks for now. And back to you, Daniel.
Thank you, Craig. Very interesting story, and it shows that although things go slowly sometimes, but steadily, they are advancing, and it's great to see that. Although we sometimes have some up and downs and bumps on the road, you know, we can have this core team continuing to think of and pushing the way forward. So I also would like to recognize Peter Berry's role in that as Health Canada, since he's connected with us today. And I would like to pass, and we're going to have follow-up questions for you, as you know. But Anivar, Peralta, you can tell us a little bit about the history. Like, since you're doing these historical recordings of what's going on, you can tell us a little bit about the 5 Cs and your experience in that role with the project that PAHO, EU Forum, and many other partners like the 5C are implementing in the region of the Caribbean with regards to strengthening climate resilient health systems in the Caribbean. So please go ahead, Anivar, and share with us some of your insights about the partnerships that are needed to foster more projects and funding for implementation. Thank you.
Definitely. Thank you very much, Daniel. Thank you for all your presentation and the introduction. Excellent work. My colleague Carmen, sorry, apologies, Carmen. Thank you very much for excellent presentation as well. And Craig as well. Excellent synopsis of the current situation and the trajectory of evolution of how things have progressed there in Canada. So I must commend all of you guys. So I'll be speaking from the project development specialist angle, based at the Caribbean Community Climate Change Center, where we focus towards building climate resilience within the Caribbean region. This also captures the CARIFORUM member states, which includes Haiti, and with our main mission to initiate and coordinate the delivery of innovative, transformative, and evidence-based climate change solutions to improve the resilience of the people within the region. So therefore, that's our response, that's our mandate. While our institutions is very small and it's growing, it's just over 10 years old. We are managing and coping with the impacts of climate change, because of course climate change is the impacts are very wide within the Caribbean. It affects the various sectors, not only health but water, agriculture, food, the environment, infrastructure, different angles where climate change affects the different countries within the Caribbean region. And therefore, the need and the urgency to respond is very, very high. And therefore, it's a lot of demand that comes to us to try to respond to them in a very timely manner. As you know, small island developing states within the Caribbean region, they are low-income countries, with very limited financial resources, including local capacities. So therefore, there's a strong urgent need to provide support. And that is what the 5 Cs, where I work, tries to do. We mobilize our human capacity and technical expertise to try to best respond to those impacts of the Caribbean nations. One of the ways that we do it is try to see how best we can mobilize climate financing, given that the economies are very small and very constricted towards the tourism industry. Therefore, a lot of financial support is required by the governments of the various countries. So therefore, we see how best we can partner with different institutions, different multilateral agencies, such as the Green Climate Fund, the Adaptation Fund, the United Nations, World Health Organization, the Pan American Health Organization as well, to see how best we can coordinate and mobilize climate financing to respond and address those climate change impacts. And now moving on towards this particular webinar, the 5Cs is very instrumental towards responding to climate change. And in this case, towards the health, we're making a focus towards health. And we have partnered with the European Union and the Pan American Health Organization with a project titled Strengthening Climate Resilient Health Systems in the Caribbean, whereby we have taken the role towards two items. One is the communication aspects, which we try to bring about visibility and highlight the impacts of climate change and how is it that the general population within the Caribbean countries can be aware of the health impacts brought about by climate change, as well as how is it that they can respond towards these impacts. This, of course, is trying to create a change in the mindset, change in practices, change in livelihoods to build their resilience within their countries, especially at the community level. Another aspect which I'm very involved in and taking a leading role on is the development of high quality concept notes, which will be developed and submitted to the Green Climate Fund. Green Climate Fund, sorry. You have known this is one of the largest funding institutions that basically provides financing at different modalities in grants and concessional loans, leverages financing with private sectors as well to best respond to the impacts of climate change, both in the mitigation side towards building low emission development pathways, and both in the adaptation aspect, towards building climate resilience. Of course, within the health sector and within this project that we are partnering with EU and PAHO, we are exploring both modalities, ensuring that we have the mitigation aspect and the adaptation aspect in those towards mobilizing financing for these countries. And of course, the whole idea is to strengthen and build a climate resilience within the health sectors to ensure that the impacts of climate change are not passed on towards the larger population. And of course, there's various ways of how to go about providing support in terms of developing these projects. I can talk slightly some aspects of it, and I believe, in the discussion, we can more elaborate on these things. But one of the things that we have to ensure is that to put all the necessary elements in place, and Daniel spoke about it, different, you need to ensure that there's proper institutional and legislative and policy frameworks in place to ensure that whatever actions are done within the health, those things are in place as a solid foundation. This includes also the health national adaptation plans. Of course, this provides the sustainability for the long term, because of course planning is done to ensure maximum impact in the long term. So this is something else that needs to be covered. And one critical aspect as well that needs to be covered is the country needs. And by that, I mean going down at the ground level with the stakeholders, with those that are being affected. What is it that they need to be responsive to climate change? What vulnerabilities do they have? What climate change risk are they facing? How is it that we can go about addressing those impacts to support those communities and so forth? So those are very important aspects. And of course, this takes time. And of course, the engagement process is iterative. It's ongoing. And we have to ensure that during this process, all the necessary information is captured. So as part of this process with the project with EU and PAHO, we're providing support to 5 member countries. This is St. Lucia, the Bahamas, Trinidad and Tobago, Grenada, and Belize. So these countries have been selected towards providing course, receiving the support needed to mobilize financing towards building their climate resilience. Of course, one of the critical components of this process is to ensure that health national adaptation outcomes and objectives and priorities are considered to ensure a maximum impact to these countries. And of course, when designing these projects, all the elements mentioned by Carmen as well as Craig needs to be focused, because now by ensuring that you have country needs, you design projects in a way that it covers retrofitting, enhancing healthcare facilities, allowing them to become smart and green. The integration of also is considered integration of renewable energy, also different aspects such as water systems, proper waste disposal systems also need to be enhanced, including also surveillance systems. All of those aspects are considered within the design to ensure that the projects are designed to meet the needs of those countries. So, and of course, it's iterative. We have to dialogue continuously with the governments to ensure that what they really need is in there. And of course, the sustainable financing, ensure that also once the project is designed and it's completed, there's sustainability. And one of the areas is to build the capacity of practitioners and technical officers, in the health facilities to ensure that the continuous monitoring, evaluation, and also the improvement of the current designs are maintained for longevity, and to ensure that these services, health services, are available to the general public, especially in times of disaster, especially in times of need. This is not only when it's business as usual, where there's no disasters and so forth, especially. So that's why these facilities are very critical. I'll leave it there for further discussion, and looking forward to hearing comments and questions from the.
We already have, thank you, Anivar, very important points. We have already a lot of questions on the chat, some of them addressing some questions and comments about the attach, which is one of the possibilities that countries have to seek for a support at the global level, and financing, also access to financing. You were mentioning many of them, that your 5Cs are working with many other partners on developing project proposals for the Caribbean countries, for the Green Climate Fund and potentially other donors. There are some comments. I see Marcelo Vega asking about other opportunities for financing. So tomorrow we're going to have a session with the Belmont Forum, which is another potential funder for climate and health. We are part of this steering committee of climate, environment, and health. There's a specific call that is going to be open, I think tomorrow, in fact, or next week. There will be open. Anwar is adding to the chat information about this session, this informative session tomorrow. We'll be there, WMO will be there, IAI and many other partners. It's to fund research for climate change, environment, and health. So I hope that can also support some actions that you want to take in your countries, but not only at the country level, but also, as many of you mentioned, at subnational levels, provinces, and even community levels, which are tremendously important. That's where the action takes place, in fact. So let's try to go as deep as possible and as engaging as possible with all these sectors and all the main stakeholders. So, and we'll continue to share with you some opportunities along this session. So now a round of questions. Carmen, una pregunta.
And one interesting and very ambitious question. So perhaps as brief as you can, what are, in your vision, the weaknesses and strengths of health ministries to face climate change? to create, for example, investment programs for climate change. How do you see that, those weaknesses and strengths? Where do we need more action? Where are we lacking? Where do we have enough knowledge and capacity to move forward? It's not just to closing the gaps, but where can we already do some implementations to solve the impacts caused by climate change? How do you see that within Mercosur? Well, wow, how long do we have? Well, yes, I think one strength is this kinds of things, being able to take part in these kinds of activities. For example, the strength of sharing information, intersectoral aspect that cuts across different organizations, and support from all organizations is very important for us, because sometimes we need someone from the outside to tell us what we need to do, even if we already know, but we don't make the decision until someone from outside, for example, the WHO or PAHO or Lancet Countdown, and tells us, well, then that is taken more seriously in a way. And so for us, a strength has been that at the political level, authorities have become aware of the fact that this issue cuts across all sectors. When governments have made it mandatory, whether by law or a decree from the executive branch, when they establish that all ministries need to work together, environment, finance, economy, health, need to work on climate change, for us, it has been a great opportunity to show how important it is and how important environmental determinants of health are. So that is one strength. But as far as the weaknesses is, well, when that doesn't happen, many times people think, well, climate change is something that is going to happen from now to 50 years. Well, it's going to be rain and a rising temperature. And so the person who is in a position for 5 years, perhaps, well, they think, well, I'm not going to be here then. I have to deal with issues today and tomorrow. So that is a weakness, weaknesses perhaps. Not being able to make people become aware of the importance of these issues right now. Another weakness that I find is that in general, the health sector doesn't negotiate on these issues at the international level. We're not always represented in framework conventions. We are not the ones who are discussing things with funding sources. It's sometimes through environment ministries or foreign affairs ministries. So that is also a weakness, because we learn about things late. For example, the attach network initiative is something that not all Mercosur countries learned about it when it was launched. So right now we are trying to make the people who are involved in those negotiating tables, let them know that we are interested, so please sign us up. So I think that is a big challenge that we have, is to create and to strengthen governance. It's not easy. It takes years to work on building teams, having a leadership line. But health and environment issues are always seen of like, oh, this is interesting. But then the urgent things are sort of leave these interesting things behind. So we're putting down fires, these really urgent issues, and those emerging issues take all the attention, and there's not a longer term perspective to look at the future. So I think that is our biggest challenge, to be able to build these teams and to be able to show how relevant these issues are and how important it is to generate the spaces like you were mentioning, Daniel, with committees, with people who are appointed, with permanent spaces, so that it's not something that happens today and then tomorrow we forget. Thank you so much, Carmen. You make great points.
Craig, I always love to hear from the ground, who are people who are working closely with interactions with communities. I would like to ask you, can you describe how the various levels of government? I mean, I think you have addressed a little bit already in your opening presentation. So how can government and non-governmental actors can coordinate and collaborate to deliver a strong climate and health program rooted in the real needs of people and communities? What's your thoughts about that, Craig? Thank you.
Thank you. That's a great question. I think there's a couple of things that come to mind. The first is it's really important to engage all of those various partners early in the process. We hear this often when we're thinking about making plans that we want to co-produce or engage with people, make sure that their objectives, their views, their goals are reflected in any process. And so I think that engagement is important. It's also not possible to engage everybody on an issue, and so you need to be practical and strategic, I think. But in British Columbia, one of the challenges and opportunities is around having clear roles and responsibilities for the various pieces of the system. So we all know that health systems are very complex. Public health is one small and important part of this very broad network that takes care of people at any place along a spectrum of needing care. And so in British Columbia, a concrete example of this is in response to the heat event that I mentioned earlier. We now have what we call the BC HARS, H-A-R-S, the Heat Alert Response System. And this is a place where a number of individuals from a broad array of organizations have designed a process to respond to heat events, to get prepared for heat events. This includes multiple levels of government and a range of recommendations for everybody involved. And so the fact that this process was motivated by an urgent need that helps it be viewed as legitimate, the fact that it was as inclusive as it could be in its creation and its delivery means that it's likely to be perceived as valuable by people and to be effective. And what we've seen is that it has been effective. We're more organized than ever for extreme heat events. And the really important part, and this ties into some of what Carmen mentioned, is the need to continually learn. And so what I really love about this group of people in this process is every time they meet, every time there's a heat event that we've had last summer, for example, it's a rapid learning opportunity where minor adjustments are made, where you apply what you learned in real time. And that's very rewarding as a person who works in a complex system. It can sometimes be hard to create change or to refine a complex process. And so our BC Heat Alert Response System is a great example, I think, of various actors working together with a common goal in a way that feels effective. And I'll leave it there to make sure there's time, but I'm happy to have a follow-up on that as well. Thanks, Daniel.
Thank you. Thank you so much, Craig, for sharing those very good insights. Anivar, I'm going to change a little bit the run of show here, and I'm going to ask you a question that wasn't discussed previously, but I think it's very important because you're bringing the the aspect of financing. So I'm here in New York for a meeting actually that happened yesterday with Wellcome Trust, Rockefeller Foundation, and 40 plus institutions on climate and health funders meeting. So there are most philanthropist organizations that, and the discussion here was how much philanthropic organizations should be doing the work of governments, and because they are filling some gaps that are being left by things that should be done by governments. And but money is not infinite. So at some point, some line has to be put on the ground, and then this is how far we're going to go. So one question for you is, how do you think that would be like a perfect or an ideal, or where should we be transitioning to when thinking of different modalities of investments? How much of governmental investments are needed through the Green Climate Fund, through loans, which basically is what the Green Climate Fund is providing, and the World Bank and these other mechanisms, versus private sector investments, versus philanthropist investments? And in your view, what's the what can you help us thinking from your end? Thank you.
Thanks, Daniel. I think that's a very excellent question, well calibrated. One approach that we take at the 5Cs is that we work with countries, because the work that we do in responding to climate change is not based on our needs. Yes, we have a vision and we have a mission as to where we want to go, but that has to be fulfilled by working with the countries. And when I say that is that the work that we do comes as a request from the countries. Let me give you an example. For example, the Bahamas. The work that we're doing reflects their needs. And that's why I said it's very important to work very closely with the countries. So we work, for example, for the concept note, we work very closely with the Ministry of Health and all other related key stakeholders, both at the national level and at the international level. For example, also there's a PAHO country office in the Bahamas. So we ensure that during the development process, that particular institution, organization is involved, along with others ones that are working in the health sector. Now, how is it that we ensure that we do not overlap with what the governments want and what we want? We ensure that their needs and their wants, their needs are captured through their national policies, national plans, national strategies, the legislation. We have to ensure that what we do is aligned with that. And of course, while there's a lot of resources out there from multiple donors, philanthropists, a multilateral organization, and even governments who also support this cause in the health, we have to be very, very realistic at what we can accomplish for the countries. For example, for the GCF, the investment projects that we are developing, for example, for the Bahamas, the 5Cs is accredited to receive grants for these on behalf of these countries up to $50 million US. So we have to work within that scope to support these countries. Now, we have to ensure that there's no overlaps. So we have to work very closely with the countries to ensure that, one, we're not duplicating what the countries are doing or what other institutions are doing. For example, if PAHO is already developing a surveillance system for climate health sensitive diseases, then of course we cannot design and use another system that will do the same work. But basically we have to use investment to build on that, to expand on that, to expand its reach and its impact. Therefore, that also allows us to be more efficient and more effective with the resources that we have. And of course, if we are already tapping into the GCF, the Green Climate Fund, for resources, we can still use resources from other donors, for example, philanthropists. But of course, the work has to complement what the current government is doing. We cannot overlap and so forth. So we have to really manage that process very, very cleanly. And that is one of the key things that we try to ensure that we do. And of course, we have to ensure that there's various needs. For example, in a different, for example, while structuring an investment project, one of the first things that we need to look at is the institutional policy and legislative framework. Does the country needs help there? No, we don't. If the country says no, then we don't go there. Now when we look at the investment aspect, the healthcare facilities, the different institutions, do they need to be retrofitted? Do they need to be greened with smart technologies and also with improved water systems, with enhanced wastewater? Is there a need to retrofit to climate proof against category 5 storms, hurricanes, when it comes to winds and rainfall and all of those stuff? Do we need to do that? Yes or no? And that also allows us to be efficient with our funds. The other aspect of the investment we have to look is now building capacities and building awareness. At what level do we go? How do we complement what's ongoing? Therefore, and that also allows us to be very useful in terms of managing the amount of funds. And of course, the investment is not limited only to one donor. For example, the concept node that we're doing with the Bahamas, we can also use funds from other sources to complement it. Because one of the requirements from the GCF is that, is there any co-financing? And co-financing comes from different aspects. It can come from loans. It can come from the private sector. It can come from from budgets from the government, and also from other promissory grants or resources that other institutions are providing to the government. So we also blend that in within the investment. So while we can, for example, for the Green Climate Fund, while we can access up to $50 million for a project, it does not limit us only to $50 million. We have the co-financing aspect, which can allow us to increase that investment amount. So therefore, the key point is we have to ensure that there's no overlap, there's complementary, and maximize as much as possible the donors that exist to create the maximum impact for an investment.
Excellent. Thank you, Anivar. And I can see by the chat that, new groups are being formed, new projects are being brewed. It's great to see the interactions in the chat. I'm amazed to see how sometimes these things can trigger action and interest by others. So brilliant. We have 1 minute left. So what I'm gonna, I was supposed to do the closing, but I'll leave it to you guys. So I'll ask for each of you in 20 seconds, each one, to say, what message you'd like people to leave this session with. What if, choose one thing that you think that we should be pursuing, or a inspiring story that you like to share and leave people inspired to advance. That's also important, right? To inspire people. I think that's what these sessions are about. So please go ahead in 20 seconds each, please, and let's finish this with a high note and a note of hope for the future as well. Please, Carmen, you start.
Bien, viendo la explosión del chat.
Well, I see that the chat has exploded and groups and connections are being created. I think that together we can do more and we're stronger. Thank you.
I agree. Greg, your notes of hope and for the future.
Yeah, I would say, don't be afraid to start. Don't be afraid to make mistakes. You're never going to be perfect doing this complex work the first time around. So just start, and there's going to be embarrassing moments where you don't do it perfectly, but just keep going.
Brilliant. That's brilliant. I mean, I hit my face on the wall many times, and I'll continue to do so in the future as well. So great. No, that's brilliant. Anivar, any thoughts on your side?
Definitely. One of the key messages is that allow the continuous engagement in this process, in the health and climate change realm. We need to be continuous in towards our engagement, towards our participation. It's a long process adapting towards climate change and addressing climate change impacts. It's a long process. We must remain hopeful. We must work as a team. We must unite, and more importantly, we need to be stewards, of our planet to ensure that we do our fair share, our part in fighting the impacts of climate change, and building resilience, especially within the health sector.
Excellent, brilliant. I mean, thank you so much for our 3 honored and brilliant panelists that help us to build this session today. I will ask you, please take a look at the chat, Carmen, Craig, and Anivar, if you hadn't the chance, and try to answer as many questions as possible. There are many asks for joining forces, for more materials. I think that you really did a great job in engaging this audience. We had over 550 persons at some point during the session. So you're reaching out not only the Pan-American course, but the globe, like we said, Philippines, Germany, Ethiopia, so all over the place. I mean, it's brilliant that, that people were here today. I would like to thank everyone for participating in this session today, and especially Carmen, Craig, and Anivar for their brilliant interventions that inspire us to move forward together. So thank you very much for your day. And I hope that we can meet in next course, maybe tomorrow in the Belmont Forum session, or anywhere else in the world on time. Thank you very much and have a good day to everyone.
Thank you.
Gracias a ustedes y sigamos en esta línea que vamos bien.
Thank you, everyone, and let's keep going along this path. We're doing well.